Have you been diagnosed with insomnia? Sleeping problems, right? Every one of us has experienced some type of sleeping problem at one point in their life. If you remember the college days, right? Or maybe even high school when you pull those all-nighters, you got to cram that test, right? And then the next day you started having sleeping issues. And then now you're into your work, you're a young adult and you're starting working and stress, or maybe even stress from your family, stress with your boyfriend, relationships, life in general, right? If you live life, you've probably had one or two sleepless moments or sleeping problems. But what if those sleeping problems became chronic? And that's what we're talking about today, insomnia. Whether it's difficulty falling asleep, staying asleep, or both, or maybe you're a light sleeper and you don't get that good quality sleep. So you've gone to your physicians, you've got the sleep aids. Maybe you started with the over-counter sleep medications, and then those didn't work, or they worked and they stopped working. And then you went to your physician, they gave you heavy-duty ones that would knock you out, but you wake up groggy and you become addicted, like Ambien, Lunesta. These are all addictive. And your energy doesn't improve. Yes, you're sleeping 12 hours a day, but you still feel tired and drained. Did you know there is a natural solution? Mother Nature built resources for us to use that we can pull from the ground that can help us regain our ability to sleep. And that's what we're going to go over today. I'm going to go over the top 7 Chinese herbs, TCM herbs, that myself and my team we use in our clinic every day to help patients regain their ability to get not just sleep, high quality sleep where you have more energy than you thought you could have. You had so much mental clarity. You performed so well at your job, at your school, at your sport, whatever. You just feel so much better. Because if you didn't know already, healing occurs when you sleep. And if you don't sleep, you are not healing. So if you have other chronic degenerative problems or other chronic disorders, if you don't get good quality sleep, it's not about hours, it's about quality sleep. If you don't get good quality sleep, you're not healing. Your autoimmune condition is going to get worse. Your diabetes is going to get worse. Everything gets worse. But then when you flip it, when you're able to help your body fix it itself, because nobody can fix your body except your body. Nobody can fix your sleep. No pill, not even me. I can't fix it for you. My team can't fix it for you. Only your body can fix it. But what my team does is we help your body fix it. That's the difference. Medication just does the work for your body. It doesn't even allow your body to do its own job. If you get on heavy duty medications for sleep, you're going to be stuck on them for years and it's destroying your body at the same time. You just don't know it, right? But let's dive in to the top 7 TCM herbs that we use in our clinic. Now, if you have watched my other videos, then in my clinic, we never use one herb by itself. We always prescribe 30 to 40 herbs together because that's what makes it safe and that's what makes it actually even more effective. And that's actually my secret sauce. That's how we became the #1 rated acupuncture and wellness clinic in the entire US. But before we go over those information, I do need to give you a disclaimer. Otherwise, Google and YouTube will shut me down. I am not a physician. Everything that I'm sharing with you is for educational purpose only. It's not diagnosis. It's not recommendation for you to do anything. It's only for educational purposes. So I am not a physician. I was not trained in acute medicine, emergency medicine. I was not trained to prescribe medications. I was not trained to do surgery. I'm going to go over some information about medication, but it is not my opinion. It's based on research. I will have all the links on my dashboard in case you want to get the information. If something is my opinion, I will let you know. Now, what was I trained in? I was trained in traditional Chinese medicine, nutrition, herbology, lifestyle medicine, restorative longevity care is something that I created. And that's about restoring your organ function so that your body can self-heal by itself and cure itself because nobody else can do it for you. All right, so let's dive in. Before we jump into the herbs, let's first get an overview of how Western medicine views insomnia. Because this is probably what you are familiar with, right? Because if you go to your family doctor, this is what they're going to tell you. So Western medicine views insomnia as basically repeated difficulty falling asleep, staying asleep, or waking too early, paired with daytime impairment. So it affects your daytime activities, right? It is diagnosed mainly by clinical history, sleep diary, and screening of comorbid sleep, psychiatric, medical, substance-related causes. So what does this all mean? The way that Western medicine diagnoses insomnia is basically on your subjective and some objective, because you're tracking your sleep, right? If you have a sleep app or if you're tracking a sleep diary, but a lot of times it's your own subjective, because daytime impairment, how is the physician going to know if you're impaired during the daytime? Is he or she, they are going to rely 100% on your feedback. So their diagnosis is based off of symptoms. It's not based off of any test. It's based off of symptoms. So if you tell them the wrong symptoms, they're going to get the wrong diagnosis, right? And that's the problem of symptom diagnosis in general. I won't get into that today. That's for another training. But what's the gold standard is cognitive behavioral therapy. That's the gold standard for insomnia, right? So cognitive behavioral therapy first, and then adjunct drug routine. PSG is just sleep study, right? It's not done all the time. What defines insomnia? Night symptoms plus daytime consequences. Diagnosis is clinical, not machine-led. So in this situation, clinical sounds professional, is basically subjective. Any subjective, that means you. That means you need to know your body, like every single detail. You need to know exactly what's going on in your body. Because if you don't know what you are experiencing at night when you sleep and during the daytime, if you don't give the doctors the correct information, they will get a wrong diagnosis. That is the problem of subjective clinical diagnosis. That is not my definition of clinical diagnosis. Clinical diagnosis, right, involves objective machines, right, or a sleep app, a sleep monitor. Those are objective. I would rely upon that more than subjective. Here's the thing. Sometimes I don't even know what I'm feeling. I just know I feel terrible, but I don't know why. We see this a lot in our clinic, that patients, they feel terrible, but they don't know how to communicate what they feel to me. If my diagnosis is 100% or 90% dependent upon you communicating to me, I'm in big trouble then, right? And that's why we use objective diagnostics in our clinic. Okay, let's jump into really quick. I'm not going to read through all this. I created these awesome dashboards. Put in the comments insomnia dashboard, and I'll have my team send the link, attach a link where you can access this and read this in detail and further. I'm just going to go over the main points. So we've already talked about how they diagnose it, right? And all of this information, there's links. None of this Western medicine information is my opinion. It is clinical research. It's published. I'm just dispensing. I'm just giving you. I'm just a messenger, right? So the gold standard is this cognitive behavioral therapy. Duration, it's usually delivered. So what is it? Short-term symptom improvement. So strong short-term symptom improvement and better long-term durability than hypnotics. So short-term, you're going to get some benefit. Better long-term durability, usually delivered, the treatment is over 4 to 8 weeks. Then the skills are continued by the patient rather than taken forever. So they teach you skills. So this is good. It's not medication. First line of treatment, the gold standard for insomnia is not medication. So maybe if your physician, if their first line of treatment for you, their gold standard for treatment for you for insomnia is to give you a pill, you might want to switch to another physician, because this is from their own research. The gold standard is cognitive behavioral therapy first. It actually works better, and it has the potential for a long time duration of effects. Next is hypnotic medications. They can improve sleep initiation or maintenance in the short term, but durability after stopping is usually worse. Side effects, sedation, cognitive impairment, falls, residual. It's pretty terrible, right? These hypnotic medications. They're generally intended for short term. Once you stop them, the potential of getting all these side effects, and you lose the sleep effect. So that's usually what physicians give you, these hypnotic medications. But the problem is their benefits are only short term. Many are addictive, and they give you all these downsides. So be careful of these medications, right? So let's go to my other dashboard, which is the herbs, right? This is probably what you're looking for, right? So I'm going to do some Western drug class matching. So these are the different hypnotic drugs that your physician will give you. And I'm going to give you the Chinese herb, the TCM herb alternative that can help. So benzodiazepines, you'll know these as Ambien, Lunesta, Sonata, rapid sedation. They knock you out. They're used for difficult falling asleep, anxious arousal, light sleep. Again, the dashboard before with all those side effects. So what are the herbs? I'm going to list the top 7 herbs. Now, again, these are not the only herbs we use for insomnia for our patients, but many of our formulas that we customize for our patients contain, if not all of these 7 herbs, many of them. So 酸枣仁, 白芷仁, 手乌藤, which is 焦藤. I'll show you the English name. I know you don't understand the Chinese name. So these herbs can produce similar effects as these benzodiazepines without all the side effects. These herbs can actually help your organs heal so that your body can regain its sleeping ability by itself. How cool is that? The next one, orexin antagonists. They improve sleep onset, maintenance by lowering excessive wake drive. Okay, so these are best symptom profile, fragmented sleep, non-restorative sleep, 手乌藤, 五味子, 酸枣仁. If I had to choose one herb that is for sleep, it's 酸枣仁. Next category, sedating antidepressants. These are the trazodone, mirtazapine. So these support sleep maintenance when insomnia is tied to low mood. Antidepressants, just persistent rumination. It's like you're constantly thinking about the same thing, replaying the same thing over and over and over, right? So which herbs that we use in our clinic for our patients that help their organs heal so that the organs help them regain their ability to have high quality sleep is 合欢皮, 远志, 茯神, and guess which herb? 酸枣仁. Melatonin agonists, these are another one. Rosamrin, melatonin, this is not so commonly used as well. These are for mild sleep onset insomnia with stress-related circadian disruption or incomplete wind down at night. What's my herb substitute? 酸枣仁, 五味子. Herbs are not going to replace cognitive behavioral therapy. So that's something like a technique you need to learn, which is great. You should learn that, right? And I'm glad that is the gold standard. So hopefully you're doing that or your physician has prescribed it. So let's get to, if you were interested in herbs, let's get into the herbs. 酸枣仁 is it's the number 1 herb for insomnia. English name is spine date seed. It has a sedative, hypnotic, and anxiolytic activity linked to jujubosides. It reduces excitatory signaling, the most powerful sleep herbs. Caution, sedation synergy with hypnotics and alcohol. Caution with serotogenic polypharmacy. So herbs, again, if you take them one by one, they may have some side effects and toxicity. But if you go to an herbalist who knows how to combine herbs to neutralize the toxicity or the side effect of one herb so that you only get the benefit of that herb, that requires training, skill. You want to go to an experienced herbalist who knows how to combine these. In my clinic, I've invented a secret way of making our herbs super safe. Next one, 合欢皮. This is albizia bark or albizia flower. It's 合欢皮 is the bark, 合欢花 is the flower. These also help with anxiety, depression, and also has a sedative effect. Okay, so these are for stress-related insomnia with irritability, grief, emotional burden. Next one, 手乌藤, which is also called 焦藤. It's fleece flower stem. It has neuroprotective, can protect your nerves, your brain, anti-inflammatory, possible sleep-promoting activity. There hasn't been much studies on a lot of these herbs. Why? Because you can't patent it. Drug companies cannot patent it. They want to patent it so they can sell it for billions of dollars. You can't patent Mother Nature. Herbs are like oranges. You can't patent an orange because an orange grows from the ground. You can only patent something that's made by man. It's great for chronic fragmented sleep, non-restorative sleep, right? Mild irritability. It has some hepatotoxicity reports exist. But here's the thing, like I said earlier, if you put the right herb with this herb, you can neutralize this liver toxicity. It's very minor, but you can neutralize it, make it almost zero, and get all the benefit. That is the beauty, that is the wisdom of herb combination, or you can say herb compounding, right? Next is 茯神, which is poria with pine root. This has a mild tranquilizing effect, possible sleep quality improvement, immune and cytokine signaling effects. It can decrease inflammation. And enhancement of inhibitory neurotransmission through GABA. So it can calm you, right? Get you focused, get you motivated, right? So see, the beauty of herbs is they have side benefits. Medications, the definition of medication is side effects. Definition of herbs, side benefits. What do you want? Side benefits or side effects, right? Which do you prefer? Next one, 远志 thin leaf milkwort root. It has sedative, anti-stress, anxiety, right? So if you overthink, you play a situation over and over and over, then you want to add 远志. 远志 is one herb we can say it opens up the brain, right? It's a very powerful brain herb, right? Can irritate the stomach in some patients. Use carefully in significant gastritis or ulcer. So again, but if you neutralize it with another herb or a few other herbs, then you can get all the benefit without the side effects. Next one, 白芷仁 biota seed. It has a sedative hypnotic seed used to calm sleep disturbances, right? The light sleep with palpitations, night sweats, dryness, constipation tendency. This herb can help calm you down and it can help you poop. How cool is that, right? All right, next one, 味子 Shishandra. This one's pretty popular, right? A lot of supplement companies are trying to use this Shishandra, 5-flavor berry. It's an adaptogenic, helps your adrenal glands, helps calm anxiety, and neurotropic signaling. In my clinic, we also use it for your immune system, your lung function and your immune system, right? Herbs can help with so many things, right? Just like an orange is not just vitamin C. An orange is a mucolytic. It can dissolve your phlegm. Did you know that? Right? It also has fiber, can help your bowels, right? Stress depletion, chronic fatigue, dream disturbed sleep, spontaneous sweating. If you just sweat for no reason, we use this herb in our clinic. Because of its astringent nature, it may be less suitable for unresolved and infectious. Again, you combine the right herbs, you can use it safely. Now, the way we use herbs in our clinic is very different from other acupuncturists, other herbologists. So I don't want you to go to your acupuncturist and say, hey, why aren't you doing this? Why are you not doing this? Why aren't you giving me this herb? That's not the point of this. All practitioners practice differently, right? So I'm just sharing what we do in our clinic to get phenomenal results. Again, I'm not telling you to substitute for medication. I can't legally say that. I can only say, hey, if it was me or my family, I would give herbs first. But the choice is always yours, right? There's some combinations. The closest is the 酸枣仁. You can read through this. There's some good combination herbs here. Safety cautions, right? One of your questions is, I'm taking these sleep medications, antidepressants. Can I take these herbs with them? The answer I'm required to give you on this channel is you need to talk with your physician. Even though they don't know anything about herbs, but legally I'm required to say that. What we do in our clinic for our patients, and this is not a recommendation, we combine medication with herbs all the time. With my specific herb combination technique, the secret to that, our formulas always help the medications work better. So that means our patients require less of the sleep medications, and the final goal is to get off those sleep medications because they have so much side effects, right? If a patient comes in, has these sleep medications, antidepressants, we give them herbs to help their organs heal. When their organs start healing, they don't need these medications. They go talk to their physicians, and their physicians basically do something called titrate. They will decrease they will wean their patients off these medications. You got to do it slowly. That's what I'm saying. You need to talk with your physician, especially antidepressants. You need to wean it off slowly because these are very powerful medications that have many side effects. And wean them off slowly. And while you're taking herbs, while we're giving them herbs, and then when they're completely off their medications, through our objective diagnostics, we confirm that their organs are functioning by themselves, then we start backing off, weaning them off our herbs, and then they sleep better, right? They're able to sustain it. As long as they maintain their lifestyle, diet, and exercise, they will maintain it by themselves. No herbs needed then. How cool is that? All right. So the product identity, extraction ratio, contamination testing, these are crucial. Not all herbs are the same. It's just like you go eat sushi. You go to one restaurant and you get salmon sushi, and you go to another restaurant, it may be different. The quality may be different. I have a sushi chef friend, and he tells me here in the US, they have different grades of sushi that a restaurant can buy, A, B, C, D. And grade A is the best. Guess what? It's the most expensive. So if a restaurant buys the most expensive herb, it's going to be the safest, best tasting, best quality, right? And of course, the customer has to pay for it because the cost is more expensive, right? But if you go to a restaurant that buys fish from a D grade, because there's A, B, C, D is the lowest grade, it's cheap. These are those buffet sushis. It's cheap sushi, but you're probably going to get parasites. You're probably going to get food poisoning. So which do you prefer? That's the same thing with herbs. Herbs, they have different grades depending on where you go. Our herb manufacturer, I've talked to them before, and they tell me when they go source herbs from China, all TCM herbs are grown in China in the high mountains, but there's still different grades. And so they have A, B, C grades. And our herb manufacturer, they only purchase grade A. They don't settle for B or C. So that gives you an idea of the quality of the herbs that we sell to our patients. And that's why when you take grade A herbs, you get better faster. When you take grade C herbs, you're probably wondering, why isn't it working? Right? Months down the road, you're like, aren't I supposed to be feeling better already? Grade A herbs, many times the first week, they already start feeling better. All right. But again, you want to get access to this dashboard, comment INSOMNIA dashboard, and my team will send you the link.